times. So it works nice. And just be aware of their toes and their fingers. Those are the two areas that they're more likely to tense up if it's too much pressure. So always look at those areas, and also breathing too. So listen to their breathing patterns. If they ever hold their breath, more likely it's too much pressure. Okay? Okay, next one, you can actually rest it up here, right on your quad region, compressing these regions. Okay? Again, you can just use 2 thumbs if you need to, your palms, your fingertips. Remember, you can do some circular friction. Remember, you can get a little bit deeper pressure too. And it's not necessarily like trigger point therapy, where trigger point therapy a lot of times will actually find an area, a tender area, press it and hold it, bring it to like an 8 out of 10 for pain wise, and it'll dissipate after 10 to 20 seconds or so. But Shiatsu is a little bit more movement, so you're not causing them too discomfort. But again, everybody's a little bit different, so some people actually like a little bit of discomfort too with their massage. But just make sure you communicate, make sure both people are okay with it then, so you can incorporate those areas then, okay? Okay, next one, you can actually put their hand on their head like this. So you can actually kind of lift up right here on their elbow, or you're compressing these areas. So you're actually making it so you don't have to work as hard then too. So the more movement you can have with the body, the more likely it's going to be a little bit more fluid, and then you're less likely to have a little bit more injuries then too. Okay. Okay. For the head region, remember the gallbladder meridian runs around this region. You can actually interlock your fingers and kind of compress, okay, all these areas. But again, if you try not to push down a lot of pressure on this region, especially if you just have a headrest that pushes in here, and also ones with teeth that are adjustable, you're more likely to break it if you push a lot of pressure straight down in this region, okay? So just go in with a little bit of pressure. But again, the nice thing is you can actually see the fingers, and you can actually see the toes and the feet. If it's ever too much pressure, they're actually going to clinch up. And they don't realize that, but that's the areas that they're more likely to actually tense up then, okay? So also with the shoulder region, you can kind of push in. And just be aware of their chin too, so make sure their chin isn't too close to the table, otherwise it kind of feels like it's kind of pushing them. So actually look at their face a little bit and see if it's doing those kind of things. You can actually kind of rock and kind of push in these areas then too. So again, you can actually interlock like this, compress on these areas, okay? So again, gallbladder meridian runs through this region, so you can actually kind of compress it going around. You can actually, remember, you can have a rocking motion if you need to for these regions. So again, with a lot of meridians, either end or start at the finger region. So what you can actually do here, so you can actually stimulate the points. You can actually, and they actually start on the sides, start or end on the sides of the fingers. So it's not directly in the center and not directly posterior, but it's on the sides. So usually when they're having problems with a certain meridian, sometimes it's going to be a little bit tender too in that region, okay? So you can actually stimulate the areas on the side, and again it goes up or down, okay? So remember, you can actually hold it there too for a moment, or go slowly in, slowly out, slowly in, slowly out, slowly in, slowly out. Remember 3 to 5 seconds or 3 to 7 seconds, so go slowly in, slowly out. And they can also use right in the palm region, compressing this, okay? So again, we talked about large intestine 4 right here, not good for when they're pregnant, but that's actually a good point for headaches then, okay? So again, you push down and kind of hook it under, but the average person might know about that point then, okay? You can also do a little tractioning with this, kind of compress it, and you can actually work down and just do a little tractioning too of the body. But again, it depends what meridian you're working on, so whether you're going to go up or down. But if you're going to mess up every now and then, don't worry about it. It's not going to harm them, okay? But again, with massage, you want to go more towards the heart with a lot of pressure. But with this, you're compressing a lot, so it's not working with the circulation as much. So it's okay to go the other direction for compressing that, okay? So then you can also have your arm underneath here like this, compress areas going through the regions.